ऐसा केस बिफोर वी क्लोज दिस जो बहुत क्लोज हो आपके हार्ट के, जहां आपको लगा हो कि यार ये वेर यू स्लेप वेल आफ्टर दैट प्रोसीजर?
Okay, so there'll be many instances, but I think one instance which comes to my mind is this about this young lady, 28 years old. She actually had a blast injury in her home in Iraq.
बॉम्ब ब्लास्ट?
Bomb blast, cylinder blast, akin to a bomb blast, but because of the fire and everything, the face just melted, and she had burn injuries to the chest, the arms, the legs, and every place. But she was the mother of two young children and very beautiful lady, 28 years old. And after she sustained the burns, so initially some dressings were done. And then they went to Turkey to get the treatment done. वहाँ पे 4-5 surgeries हुई, when they were not happy and satisfied. So then they came to us in India. They came to us at Medanta. So where we sort of, when we saw her and looking at her, you could see the grief and the fact that, she had totally lost hope. Face was like a scar tissue. She couldn't open the eyes. वो जो उसको ठुड्डी थी वो चेस्ट के साथ चिपकी हुई थी because of the scarring in the burns, and the whole of the skin was scarred. So we basically set out on a procedure, on a plan to reconstruct the face. So we used a lot of body tissues, we used a lot of tissue expanders.
So before you started the procedure, what was the psychological state of that?
Quite bad, and she had come up with a lot of hope. She came to us with a lot of hope. Because somebody told her, okay, if anything can happen, it can happen here, in this hospital, here.
Wow. So, and she was like not even Indian resident. Still,
She was not an Indian.
She was directed to India कि कुछ होगा तो यहाँ पर
यहाँ पे
होगा.
हो सकता है, because she's already had some surgeries in Turkey. So when, we have these facilitators who basically are from the same countries, but they also help align the patient to the correct hospital and the correct doctor. So one of those person brought her to our clinic, our hospital. So when we saw her, we could see that, it is not a one-step surgery. So we embarked on a journey. Obviously, we consulted the patient. We told her that she requires multi-step surgeries, and we need to use a lot of your body tissues to reconstruct the face and the neck and the other parts. So we actually created a lot of extra tissues where the patient had not sustained burns, like in the back, in the thigh area. And we reconstructed the whole face. And this is one patient in whom we actually made a nose on the forearm. And that was the final step of the reconstruction. So we reconstructed her forehead, the eyes, the cheek skin. So basically unscarred tissue was transferred to those areas. And ultimately the nose was put, and she's now able to breathe. She's able to go to a public place without hiding her face. She used to be in burqa all the time. So for me, the most exhilarating experience was when I had gone to Germany for a meeting, and she was in touch with us on WhatsApp. So I just messaged her that I am here in Germany for a meeting. So she flew down from a different city, came down to meet me, and when I saw her and the look on her face, said everything. And to me, I think for me that was worth making the whole trip, besides the congress or the conference which was there. So when I met with her, we interacted with her, she had started her life again. She's become a German citizen. She's married again. So
First
and
marriage,
she can, because the first marriage, because of the burns and all that, the face was so much distorted that the children were with the father. And they said it's better that she comes back. When she comes back, she has to be sort of reconstructed. But then it took her so much time. So I think the familial reasons for not going back would be something which is beyond the scope of what we are talking about. But she's now regained her life. She's regained the dignity and the will to live. She's married again. She's quite young. She's just about 35 now. So what I mean to say is, for me, that was an experience, worth traveling thousands of miles, and that made my day and made me, made me feel that yes, I'm a plastic surgeon for a reason, because we try and help people regain the self-esteem, the confidence. Aesthetics is part of the surgery, but then reconstructive surgery, aesthetic surgery are all basically different parts of plastic surgery. To mold back into shape. So plastikos is a word which has come from the Greek mythology that means to mold back into shape.
for you.
So we have tried to mold back lives into shape in a way that they can live their life with dignity and
Respect.
Dignity.
And most importantly, self-respect, right?
Self-respect, that's what dignity is all about.
Yes.
And being able to go out in the market and not feel that people are staring at them.
So touching, Aditya. This is like giving someone their entire life back. And
Yeah, for a young person it is. Yes.
Yes.
And this is a person who could be a candidate for a face transplant, but then we were able to do all those things, but obviously over a period of 1.5 years.
Yes.
A lot of hand holding is required and a lot of counseling is required for such patients.